Okay, we'll be learning about transient gestational hypertension. The ISSHP introduced the term transient gestational hypertension to describe a de novo hypertension that develops in the second or third trimester and resolves without treatment during the pregnancy. Women diagnosed with transient gestational hypertension have a 20% chance of developing preeclampsia and another 20% chance of developing gestational hypertension. Therefore, these women should be monitored throughout their pregnancy. Ideally, home BP measurement should also be incorporated into their monitoring schedule. So they should always be having home BP measurement. And coming to preeclampsia, as per the earlier diagnostic criteria, preeclampsia is the development of hypertension and significant proteinuria after 20 weeks of gestation. Although hypertension and proteinuria are considered to be the classical criteria to diagnose preeclampsia, in the current guidelines, ISSHP, proteinuria is not mandatory for a diagnosis of preeclampsia in women presenting with hypertension in pregnancy. Even in the absence of proteinuria, diagnosis of preeclampsia is made if they present with evidence of maternal acute kidney injury. Okay, I'll repeat the line because this seems to be a very important line. In women presenting with hypertension in pregnancy, even in the absence of proteinuria, a diagnosis of preeclampsia is made if they present with evidence of maternal acute kidney injury, liver dysfunction, neurological features, hemolysis or thrombocytopenia, or fetal growth restriction. Now, this point is considered to be very important. So, maternal acute kidney injury and liver dysfunction, neurological features, hemolysis, thrombocytopenia, or fetal growth restriction. Besides the antenatal manifestation, preeclampsia may develop for the first time intrapartum or early postpartum in some cases. Chronic hypertension, a diagnosis of chronic hypertension complicating pregnancy is made when hypertension is diagnosed before pregnancy or is diagnosed before 20 weeks of gestation. Chronic hypertension with superimposed preeclampsia. About 25% of women with chronic hypertension will develop superimposed preeclampsia. These rates may be higher in women with underlying renal disease. A diagnosis of preeclampsia superimposed on chronic hypertension is made if there is worsening of blood pressure in the presence of new onset proteinuria, or if there is evidence of dysfunction of any one of the maternal organs consistent with preeclampsia. Eclampsia is characterized by the occurrence of new onset tonic-clonic seizures. This is a very important point. Tonic-clonic seizures and or coma during pregnancy, labor or the puerperium. In 80 to 90% of cases, eclampsia is preceded by preeclampsia. Eclampsia is preceded by preeclampsia. However, in a small proportion of cases, the presentation of eclampsia is atypical without the classical signs of preeclampsia, hypertension, and proteinuria. The dictum is to consider any episodes of fits in a pregnant woman after 20 weeks of gestation as eclampsia unless proven otherwise. Preeclampsia is a multi-organ disorder characterized by the development of hypertension and significant proteinuria and or evidence of. Okay. So, preeclampsia is a multi-organ disorder. That's the first point that we are learning here, characterized by development of hypertension and significant proteinuria and or evidence of one of the maternal organ dysfunction is present. Organ dysfunction. Okay, sorry for the background noise. If you hear any, I'm really sorry for that. Okay, so after 20 weeks of gestation, construction work is going on nearby. So that's why. Now coming to the incidence, there's a wide variation in the incidence of preeclampsia or eclampsia worldwide. The National Eclampsia Registry of India, you call Foxy ICOG. Okay, Foxy ICOG reported that the incidence of preeclampsia is 10.3% preeclampsia. Okay. Coming to the next page, and NER, that is the what we saw, the National Eclampsia Registry 2013, and that of eclampsia is 91.9% and preeclampsia 10.3%. Okay, the incidences of preeclampsia and eclampsia reported by the Institute of Obstetrics and Gynecology Chennai from the period from 2010 to 2017 were 11.3% and 0.86% respectively. So there's a considerable decrease from 2010 to 2017. So we'll be seeing the criteria for diagnosing hypertension in pregnancy in the remaining videos. Thank you.